So this session is going to be about analyzing local actors and processes. So our keynote speaker for today is Dr. R. Balasubramaniam, or also known as Balu, fondly by us. He is a founder and president of Swami Vivekananda Youth Movement and Grassroots Research and Advocacy Movement India, which is also known as GRAM in Mysuru. So Balu, I welcome you, and I please request you to do the keynote address.
Good afternoon. Talking on a subject as abstract and vague as analyzing local actors and processes itself is a challenge. And to compound the challenge, to talk after lunch, you know, there's a standing joke that we all share in these conferences. There are two kinds of lunches. One is a working lunch, and second one that we can all get is a lunch that works. I hope, and the way the lunch was served to us, I hope it's not a lunch that works. And she was talking to you about how you must have had a good lunch. I hope you didn't have a good lunch, because if you have had, then it's going to be difficult for me to hold your attention. So in the few minutes that I would like to share some thoughts. When I first saw this subject, and I asked Upen, why me? And he said, well, you have worked for 25 years as a local actor. Only then I realized, okay, what I did was local action. Because I keep trying to talk to a lot of people and say, we have a lot of global players wanting to come and have local action. I always strongly believe health is an area where the missing voice is local players have to necessarily get global voices. And that's when, in my view, true equity can happen. So I start off with that very strong belief that local players need to be noticed globally. Otherwise, we have this usual mafias in every country, in WHO, in World Bank, and the same faces, the same mafia groups coming together, talking the same thing. And in all this drudgery of repetition and no fresh ideas, we lose out the most critical element, the voice of the local person. And so I'm actually very glad when Upen told me that this topic is there. So Deva, congratulations for thinking of this topic. At least there's some space for local voices. And being an activist, I can't resist starting off with a little disruptive note. That being said, I started thinking, who are the local actors? If Upen thought I was a local actor, and all the time I was thinking I'm working with local actors. So then I realized, even to define a local actor, it's so confusing. And maybe depending on where you are on the bandwidth or on the vertical chain of players in healthcare, you see everybody below you as a local actor. And that's a tragedy, because how local is local then? And for when I was also part of the mafia, so you can also put me into that ring. So either in Geneva or in World Bank, DC, when you're there, local for them is the World Bank office in India. No, local people, we should inform our local people. And I would always imagine they're talking about people on the ground, but for them, people on the ground is World Bank New Delhi office. And that's the reality. And when you're sitting in Delhi and you're talking, and nowadays I don't attend these meetings. I usually don't even come for conferences, because IPH and I have a special place in my heart. For them, I came here. Otherwise, I usually think, we all talk, we go back, but the man's health on the ground remains the same. So I'm not skeptical or cynical. I'm just stating facts as they look to me. And that's a local voice you need to capture. So when you come to Delhi and you're talking in Ministry of Nirman Bhavan, depending on what kind of a player you are, if you're a pharmaceutical player, I don't know whether you're global or local, or if you're an activist, how it looks at it. And for them, the state government is local. And for Bangalore, maybe the Jilla Panchayat is local. So I want to actually categorize and reframe, for the purpose of my discussion, in four distinct set of actors locally. The first set of actors, I would like to see them as possibly grassroots bureaucrats and representatives of the state governance systems itself, the panchayat. And I'm a panchayat activist, so I strongly believe we have not localized health responsibilities in the panchayat enough. And that's why I would like to bring them onto the table and say panchayats are a very critical component of local actors. And the processes that drives panchayats to ensure healthcare for their constituency to me is extremely critical. And we have completely ignored it, and most of us in this country have ignored it. The second local player, which I think is important from my own experiences that I've gained, are the CBOs that work. And many of us NGOs hijack or usurp their responsibility in healthcare and sort of make it our responsibility. So the CBOs to me are a critical component. Having worked with women and women's health issues at the grassroots with tribals, I do know how for a large part of my own life I had hijacked that voice, and how today for a large part of my life now I'm trying to give the voice back to them. So it's a very strange life mine. So it's a learning curve, and I think it depends on which part of the learning curve you are, you will have to decide what you want to do. And the third, I think, are still NGOs, and they're relevant. And I would not dismiss the relevance of NGOs, real sound NGOs who are conscientious, conscious, and appreciative of both their limitations and their strengths. Most of us NGOs are very strong in our strengths in talking about it, but we generally like to wish away the limitations that we operate in, the difficulties that we have, or the differences that we create in communities. I would like to be cognizant of it because they are also important local actors. And the fourth, and which matters to me the most, and that's what my book is also titled, and that's the voice I'm trying to get back into every conversation, is the citizen, the poor little man on the street, for whom we do all this. And does it really matter in this equation? And does he have a voice? And if he doesn't have a voice, why doesn't he have one? And what are the processes that we do to get him to participate in matters that are close to his life and conditions? So determining local actors itself is a challenge, and I would describe local actors this way, the 4 domains. And I would start off asking myself, why should they even engage in healthcare? What's in it for them? Because in our country, as much as in other countries, the challenge of getting actors to participate in matters which are defining public good is such a challenge. And health being such a private incentive for me to stay healthy, how do you get local actors to actually participate in things which are really delivering public goods? And I found a strange, I found working with panchayats, I tried an experiment last Gram Panchayat elections, because every panchayat member spends 5 to 10 lakhs, depending on the size of his ward, to get elected. And as a small process, as a political process, and I believe development is politics and you can't escape it. And healthcare is as political as you can get. That's a reality, and we shouldn't dismiss that reality. And because most of us activists think anything electorally, any electoral frictions or tensions on the ground is not for us, without realizing by the very fact you're engaging with ordinary citizens, you're already political. You may not be electorally political, but you are political. And I concede that it took me 20 years to discover that, but I did discover it. So 7-8 years ago, we ran a small experiment, and we realized our paradigm, whether it's health, education, anything we do is going to be built around building human and social capital. And anything that contributes to building this is what we would engage in. And that's why to me, local actors and process is very close to my heart. And in the process of constructing this capital, we realized if you don't construct political capital, you really do not have much say in matters of social determinants of health. And that's a reality too, because we can talk any amount of social determinants. If you are absolutely blind to the political economic factors that happen locally, and if you are blind to the fact that political players do constitute the agenda of the panchayat, you are actually missing the point. So we tried an experiment, and very successfully it's ongoing. It's still an ongoing experiment, and if any researcher wants to study, I'd be happy to work with them. What we did was we deliberately built 30-35 people, mostly women, in HT Kote's panchayats, created an expansive amount of social capital for them, and made them stand for elections. Unabashedly said they are going to stand for elections. And surprisingly, 28 of them actually won without spending a single rupee. And for an indigenous tribal to actually win an election itself is just historical correction of injustices to me. And in my constituency, the MLA calls himself a tribal, but he's not a tribal. So we have those battles too. And after having done that, why is it important to me? Because I believe that the Panchayat Raj agenda has been hijacked to just schemes of government. It's such a sad part. The role and responsibility of seeing Panchayat as local governance unit is completely out of the picture. And it's about how many houses we get to build, or how many votes we can get the local MLA to win in my ward, and how many times you can, Gram Sabhas are a joke, participatory democracy is a joke. But how do you get health onto their agenda? How do you really get these local women to participate? And that's where working with women is extremely easy, because they understand health issues better. And that's my Very presumptive, but absolutely judgmental, and a very strongly judgmental statement born out of experiential knowledge. And I have no hesitation in saying it. So working with them and talking to them about maternal issues or child health issues, they resonate. And luckily for us, around 16 of them became presidents of the Panchayat. And so we could actually get health onto the table. Like I said, it's work in progress. It's only 1.5 years since they've been in position. It's extremely challenging to renegotiate with a very male-dominated Panchayat and get them to see beyond schemes, houses, NREGA, action plans, and look at health as a real entity. And the challenge we found, a common generic challenge I found in all the 4 players I mentioned, less so amongst NGOs, definitely amongst citizens, CBOs and Panchayats, is a huge problem. And I think that is where I believe research organizations have failed this country, whether it is state health resource centers or NHSRCs or GRAM or IPH. GRAM is trying to remedy the situation to some extent now, but we are trying, is all I can say. Is in translating the enormous body of knowledge we create to something application driven and taking it back to communities where it should rightfully belong. I strongly believe in it, and that's why we communities have not been able to indulge and play the role that we want them to act out. We call them actors, but what are they supposed to act out? And to me, I identify 2 areas where they can really act out. In my view, and these are experiments for many of us have tried it, I think the biggest challenge that most of these local actors have in negotiating the asymmetries of information and the asymmetries of power. Most people, at least I must have seen thousands of people in my 32 years of activism in health, people are absolutely ignorant of what a primary health center is supposed to do. As simple as that. It begins with that. Or a sub-center, or an ASHA worker, or the combination of ASHA, Anganwadi, and A&M. When you don't even know the grassroots bureaucracy and the deliverables of the grassroots bureaucracy, and you have no real structured relationship between the local panchayat and the PHC, and the state is so nervous, it doesn't want to even try that experiment even in a few districts, say, can we really hand over PHCs or Anganwadis or sub-centers to the panchayat? And in my view, if there's a systemic change is not going to be brought out, we can as well say panchayats are no longer actors in this game. Because without a clearly defined line of power and control of panchayats and a state-initiated process to reduce this asymmetry of power, after reducing the asymmetry of information, we have virtually eliminated all actors. So to me, the biggest mafia in public health is the state itself, in my opinion. And I'm very clear about this. Ravi is also here, and we realize, we were made actors, funnily. We were actors in a game called results framework, or whatever you call it, at a very high level. And we actually acted, that's all we did. And the government acted better and said the most efficient functioning RFD was the health committee. And they dismissed all of us off, said we don't need these actors. Because it's such a frightening thing, because engagement is an extremely complex phenomena. Engagement is a frightening phenomena. And if you're not primed the state to engage with civil society actors like us, they can get nervous. And we can cause quite a bit of nervousness. And so when the panchayat is asked to engage in healthcare, and you don't reduce the asymmetry of information or the asymmetry of power, I think we are just doing lip service to local actors. So let's accept it. I think you may disagree with me, but this is my look. We may publish research to justify some of our stance. I can tell you I'm a researcher. And I am very confident I can write research reports both ways. There's a famous, recently, I don't know if you guys watch, there's this comedy talk show of John Oliver. And if you go watch his shows, the first half is very lewd and critical, but the second half is very intelligent. And I usually watch the second half. Recently, I brought out a show on scientific research reports. Globally, he had demonstrated how the same research report gets articulated by different actors differently. So whether it's tobacco, alcohol, microcredit, I can argue both ways. I can bring you literature review which will justify both things. I can even get PhD thesis which will argue both ways. So I'm not getting into that. So I'll stick to my experiential knowledge. So panchayats, and how do you reduce this asymmetry of information and power? Would you really hold the panchayat ward member accountable for a maternal death in his ward? Can you translate this power to accountability processes also? And if you don't do that, panchayat member is not going to care a damn. The second is the local NGOs, and we constitute such a small percentage. I think more than action, most NGOs are decibelly loud. And this become, we all have these fashion statements that we put out. And I always wonder, in reality, do these fashion statements make an on-ground impact? And I'm constantly trying to validate my own fashion statements in the past, my current fashion statements, and saying, does it really work? And I can tell you, what really works in my view right now is the last actor or the last two actors, the CBOs and citizens. You can really energize them. I have had wonderful battles. I've been beaten up, arrested. I've had my fun. But the fun was funnier when you have 500 women with you. When you have 600, 700 tribal women going and demanding from the local primary health center doctor or the panchayat member saying, why did we allow this maternal death to happen? Forcing them to do a verbal autopsy. No, it's not just a research report. You actually make it happen and enjoy the process. So I'm now convinced that if you can empower our citizenry, and through the citizenry processes, the CBOs that they subscribe to or belong to, it will work. But there's a danger in this, I see. I think this whole CBO movement has been hijacked with extreme short-sightedness, both by NGO groups and the government, into converting an excellent social platform, a social collective, into, in my view, banal microcredit groups. We have reduced the power of citizenry to just look at savings. I brought my 2 rupees, I give my 2 rupees, I walk out with the passbook. And a week later, oh, 100 rupees I've saved. I think we have destroyed this entire extraordinary, because I've worked with women's groups for the last 30 years, and I know the power that we had. If we gave a call for action, we could get 3,000 women to sit around the forest department. Today, if we give a call for action, they'll say, sir, nama sangha ke eshtu kodtara avaru? In Kannada, it means, how much will they pay a sangha for that? Because the sanghas and collective platforms are now today come to become, they are collective negotiation opportunities. But for the players, like, I've had MLAs coming to this panchayat and saying, we will give you 2,000 rupees. You get all the 20 votes of your self-help group members. So they become collective bargaining platforms, not for issues like health or education or local self-governance, but for a captive audience to translate my corrupt governance practices. And this is a reality too. So how do you act to this reality? How do you really work? So I believe that wherever self-help, the real understanding of social and human capital has worked, economic consequences have ensued. And when this agenda got hijacked to create economic capital, without building the human and social capital, people have lost their way. And so we have challenges. We work with tribal groups, non-tribal groups. Recently, I had one of my PhD students actually do one of our papers on this. We actually compared the tribal groups that we have created, which are more than 20 years old, and we had no money. And having no money is an advantage for NGOs. You have to learn to work with limitations and the constraints of resources. And we worked with non-tribal groups, and that is loaded with money because NAFINs, everybody wants to give money to non-tribals. So we give them a lot of microcredit. And within my own organization, I realized the agendas are different in different self-help groups. In the tribal groups where we have built human and social capital, the power of negotiating with the state, with the panchayat is so high. And in my non-tribal groups, all they're concerned about is it's a reality. And so we are actually, in different ways, I believe, are creating superfluous processes to take away the real agenda of social change. And the last, like I said, is citizenry. If we can really energize an extraordinary set of citizens on the ground, and we have tried that, some of you here might be familiar, and I think in another room, Sham, my colleague, is presenting on that, is can you use the power of technology and use the power of technology to scale up empowerment? And when I say empowerment, I would like to warn Ashraful is here, so I would like to, definitely I wanted him to hear this. The state is, in its urgency to ensure community empowerment, is actually enforcing engagement. That doesn't work. I think I would like to distinguish enforced engagement versus empowered engagement. Empowered engagement is an evolutionary process. It organically has to evolve. It takes 20-25 years for engagement to evolve. Whereas the state will come in and say, VHSNC, you have to make a committee. VFC, you have to make a committee, village forest committee, village education committee. And I can tell you, I have done enough research to show you, people don't know which committee they belong to. And sir, yado bandru sir hesaru barkondu hodru. They came and they wrote my name and went, I think I'm in some committee. Karitar sir kardubiಟ್ಟು 50 ರೂಪಾಯಿ ಕೊಟ್ಟಾಗ ಗೊತ್ತಾಗುತ್ತೆ committee ಇದ್ದೆ ನಾನು ಅಂತ. No, these are realities, and if you've worked in grassroots, you'll actually understand. So we're creating these falsified actors whom we are justifying legitimately as a list that the department has, And you think through them you can actually bring about change. So the Arogya Raksha Samitis, VHSNCs, I'm actually worried to call them local actors now. I'm worried to give them the representation, the responsibility of representing their constituency and negotiating with the local missionary in matters of local governance. So this state-promoted, enforced engagement is detrimental to this evolutionary process which many of us have built. And we have this roster in those engagements also. I'm a strong supporter of affirmative action. But affirmative action after suitable priming and creating of an ecosystem is what will work. If you force an affirmative action because the government or the Supreme Court or a political party is breathing down your neck, we are going to destroy local action. So I think there are facilitatory processes that encourage local actors and local processes. There are people who believe that they're facilitating but actually inhibiting local actors and local processes. And at the end of the day, we have not even brought in the complex machination of the private sector. The private sector, private clinic, quackery, that business. And I responsibly and respectfully say, another major health actor is the traditional health systems. Somehow the state doesn't legitimize it, doesn't see it with the respect that it deserves. I treat it with a lot of respect because I think they're very critical elements in the health system. So I think all these local players and how they engage with the rest of the health system in demanding and supplementing services that they deserve is the process that we need to cherish and build. And in conclusion, legitimacy of that space has to be part of the ecosystem. And whether we like it or not, public health or community health processes are initiated and driven by the state. We can never escape the fact, at best all of us, the so-called local actors, can supplement, we can never supplant state action. So that is why the state, and I'm very glad Ashraful came here to pass remarks on this, is extremely critical to understand that we, the state, if we do not create that ecosystem where citizenry can flourish, where the entire community-based organization movement can revolve around social collective change, rather than just negotiating for private gains like my house or my street or my water. And if you can translate the state's intent into policy change at the panchayat level, and if you allow NGOs to be functioning with a conscience, because NGOs will become irrelevant once the citizens and CBOs get empowered. I think this insecurity that pervades NGOs itself is a detriment to the whole process of social change. And if you can ensure all this that happens, I think that is true equity in health. Equity in health is not just the way we draw medical services from the system. Equity in health, I believe, is participating without the asymmetries of information and power. And if we can negotiate that change, I think that will be a great day for Indian public health. Thank you. I'm very mindful of time before I get a slip, so I beat you by 30 seconds. And it's a pleasure for me to have Ashraful here, a good friend, and has been in the field at multiple levels, has been with the health minister, seen change from very close quarters, and understands the political ramifications of promoting local action. And now I presume you are with the Food and Civil Supplies Minister. Okay. And so he's got a huge experience with him, and I would like him to share a few special remarks here. Sir.
Thank you.